Bismillahir Rahmanir Rahim.
Now, hoarseness is defined as rough, abnormal, harsh quality of voice. Hoarseness is a symptom, while when we talks about dysphonia, dysphonia is a diagnosis. Causes of causes of hoarseness of voice are very many. One has to remember they're starting from the congenital ones. One talks about congenital webs giving rise to hoarseness of voice, whereas infectious and idiopathic types like laryngitis, bacterial, viral, fungal, vocal cord immobility, muscle tension disorders, whereas toxins and trauma can also cause hoarseness of voice like laryngeal cysts, nodule polyps, and ulcers. Vocal abuse, rhinitis edema, arytenoid dislocation, vocal fold granulomas, caustic inhalation injuries can give rise to hoarseness of voice. Tumors, as far as tumors concerned, there can be benign tumors as well as malignant tumors giving rise to hoarseness of voice. And the benign tumors, recurrent respiratory papillomatosis is the important culprit, whereas laryngeal cancer can also give rise to hoarseness of voice, and among other benign tumors, there are laryngeal masses due to hemangiomas and lymphatic malformations. Endocrinal causes of hoarseness, hyper, hypothyroidism, laryngeal myxedema, or adrenal, pituitary, and gonadal disorders, and pubescence. These are endocrinal problems giving rise to hoarseness of voice, whereas neurological causes can be spasmodic dysphonia and tremor, cerebral palsy, multiple sclerosis, extrapyramidal lesions in Parkinson's disease, stroke, Guillain-Barré syndrome, myasthenia gravis, vocal fold paresis or paralysis, and other neurological disorders. Systemic problems giving rise to hoarseness of voice is GERD and connective tissue disorders like rheumatoid arthritis and systemic lupus erythematosus, as well as psychogenic causes of hoarseness. Thank you very much.